first let's go through the equipment that we need to perform a supraglottic skill. So you'll want a variety of sizes of the adult supraglottics. A general rule of thumb is a 5 fits most adult men, a 4 fits most adult women, and honestly for a mannequin, usually it's a 3. Technically the manufacturer guideline says that it's weight-based, but there's studies and good evidence that probably just going by gender will get you where you need to be with most patients. You'll also want to make sure you have gel and some sort of securing device. These usually come with the eye gel. What doesn't come in the package with the eye gel is your gastric tube. So make sure you have the appropriately sized gastric tube so you can insert that to decompress the stomach. Confirmation with end-tidal CO2, and then don't forget SpO2 to make sure they have good sat reading. Some padding if we need to troubleshoot, and then my BVM with my PEEP valve on it. So let's start at the top. We're going to take our supraglottic device out of the cradle. We're going to use some lube. Just go ahead and lube the back of the device. You don't need to lube the front of it. This is where it's going to slide along the hard palate. We're going to position the head and we're going to perform a tongue jaw lift and then insert the supraglottic device midline until you feel some hold up and you see that the teeth are between the bite marks. Go ahead and bag for me. My first confirmation is to see that I just have good chest rise. So again, gentle bagging of the BVM with a couple fingers should give me chest rise. Once I see chest rise, I'm going to now confirm further with end-tidal CO2. Now you may have variable readings for your end-tidal with this device. If you have a really good seal, you should have a good waveform and you'll aim to be between 35 and 45. So once I've confirmed I have good ventilation, I'll get my rate, generally 10 to 12 for adults, but I'll adjust the rate to get the end-tidal between 35 and 45. Now I'm going to look at my SpO2. So if I have a poor sat reading, I can try a few things. One is I want to troubleshoot the patient, listen to lung sounds, make sure I don't have something like a pneumothorax or obstructive pathology like asthma, and then I'll adjust the PEEP. So just like I do for BVM, gradually increase the PEEP until you get your sats up to, they don't have to be at 100, but somewhere between 92 and 98%. Lastly, we're going to secure the device. So the tube tamer that comes with the device has these little posts here. So we're going to slide this under the back of the head. We're going to take it, secure it to one side, but as I tighten it, I want to make sure that I'm pushing the device down and tightening both sides sort of equally so that I don't rock the device to the right or the left. Once it's secured, make sure that it's still midline, and this is a good time to listen to lung sounds over the epigastrium and reconfirm that your device is in a good place. Now, lastly, for our supraglottic device, what we want to do is insert a gastric tube. So our gastric tube is really helpful so that we don't have air going into the gut and we don't have emesis. So along your supraglottic device, there is a channel here for your gastric tube. Make sure that you lube your gastric tube really well before you insert it. And then, we're going to measure from the epigastric region around the ear up to the device to give us a general idea of where to insert it. So inserting the gastric tube into the channel, ensuring I have plenty of lube. I shouldn't meet a lot of resistance. So just make sure if you're meeting resistance that you have plenty of lube on this device. Insert it all the way down to your mark. And then we're going to attach this to a large syringe. And we're going to insert air into the stomach as we listen with our stethoscope. And then we can go ahead and attach this to suction. Now make sure once this is inserted that we listen to lung sounds and we reconfirm that our end-tidal and our SpO2 are unchanged.